So this is another patient, 48 years old, headaches, lightheadedness, and what do you think it is? So it's a junctional rhythm. The rates was between 40 and 60 beats a minute. And the treatment would vary depending, on whether she was on any medications, and all those things would be taken into consideration. 62 years old, end-stage renal disease, shortness of breath, missed his dialysis. So the thing is, these bits you can see, will give you some idea that he has hyperkalemia. And because of the missed dialysis, there is a lot of he's hyperkalemic and he needs to be dialyzed. He just went through this one. It's a 54-year-old patient who comes in with chest pain. Sorry? Yes. So that's the Wellen sign. You see that? So he underwent and had a cardiac cath and had a PCI to the LAD and did reasonably well. What do you think here? He's a 39 years old, came in for a family history of sudden death, and that was his history. Brugada, that's very impressive, yes. You can see these things, giveaway signs of Brugada. So a little bit of the Brugada, it's an autosomal dominant genetic mutation. I don't know how frequent it is in this part of the world, but we have seen quite a few of these patients. I have one who was 20 years old, who was found on the field, unconscious, and was resuscitated, and he had Brugada, and he underwent it and had a defibrillator placed, and I continued to see him for the past 10 years, and he had only one event, which was successfully treated by a shock from the AICD. What do you think is happening here? Nothing unusual, a lot of PACs. And another patient, 68 years old, palpitations and generalized weakness. What would you do? Anything, any clues there, which makes you? So the rhythm is too fast. You can, treat him with IV drugs to slow the heart rate. This is a life-threatening condition. It's a polymorphic VT and requires some urgent attention. So it's just a question of determining, what it is and what to do. So magnesium was given to him, and he was actually shocked out of this rhythm. This is an interesting one. A young man presenting with palpitations, dizziness, lightheadedness, and that's what his EKG looked like. So he has atrial fibrillation, but there is something unusual. It is too rapid, too fast. What do you think it could be? Say any alarm bells? I certainly, this is one of my patients who presented to the emergency room for the first time, and we actually decided that this is something where we would shock this patient out of the rhythm. And the reason was that I thought that this AFib was too rapid. There was an intraventricular conduction defect, and the question was that whether he had WPW syndrome. And that's what he had. So once we shocked him out, that's anything unusual. Very fast rhythm, a narrow complex tachycardia. If they are hemodynamically stable, we can give him treat with medications. If they are unstable, they probably would require a shock and, say, to convert them back into sinus rhythm and maintain some hemodynamic stability. So this was a patient who was given adenosine because he had a very rapid heart rate. So you can see these flutter waves. So he has atrial flutter with variable conduction, and that's what it is. So just to show what a monomorphic VT looks like and what a polymorphic VT looks like. My time is up. I have a lot of EKGs, but this was supposed to be a workshop, but thanks very much.